Okay, we just did a admitting of a large group. See some other ones are coming in. Welcome, welcome. This slide is already up for you so that we have folks joining know that I've logged into the right place. We are really excited about today, and I'm going to start in just a minute. I don't see on my screen. Oh, yes, number of participants. Okay, great. All right, I am just going to get us started. Welcome, everyone. This is just going to be amazing. The number of people who signed up for today. We are opening it up so that folks can roll in without interrupting anything. So we know the group will get larger. My name is Ramsey Mahavitz, and I am here from the I am a resource teacher here in Family Support Services in Baltimore County. I'm accompanied by my lovely colleague, Miss Sherelle Pinkett. The two of us are going to be the support monitoring the chat today, questions and answers, and admitting people. We want you to know that a little bit about our office, Family Support Services. One of our primary missions is to provide families with information about disabilities and increase awareness of any community services that may offer some support. While we strive to assist families in their search for resources, BCPS does want to make clear a quick disclaimer that we are not specifically endorsing any agency or provider, but we will continue to share with our families those supports that we are aware of in the community, and specific questions about them should go directly to them. Okay, so without further ado, let's talk about who we are bringing to you today. Baltimore County Schools has worked for many years with Dr. Tana Hope, and we're really pleased to have her back. She is a clinical psychologist from Kennedy Krieger Institute, and she is going to be with us today to share research and strategies for supporting students with ADHD. We know ADHD impacts a large percentage of our students across all grade levels and in many different ways. And I think that Dr. Hope is well versed and probably capable of a multi-day seminar to learn so much about ADHD, but she's prepared for us a nice bite-sized lunch hour workshop for today. Before I hand it over, Dr. Hope, I do want to go over just a few logistics for our participants. So bear with us as we go through just a few slides, 2 slides. First one here is just an enlarged version of what you may have seen on that opening slide, letting you know that if it helps with comprehension, there is the closed caption option, and also you can choose a language in closed caption that may support. This is also a chance for me to let you know that we are going to offer this again in January, and at that time we are going to be set up for live interpreters that are going to be available within the platform. But we do know that we have some interpreters with us today, and welcome to you all. The second slide here and last slide before I turn it over is for understanding. Now it's interesting, I just want to say we are defaulting in the Zoom platform to, because of the size today, to having participants muted and camera off. So if we've done something there, just if you can adjust your own for cameras off and muted, that would be really helpful for distraction. But we do want to make sure that we are here to answer any questions that may arise from our participants today. And that feature that's down at the bottom ribbon, Q&A, is a place where you can type in your questions. If they are easy enough and within our wheelhouse, Sherelle and I will certainly be answering throughout with written responses. Those questions that are for Dr. Hope, she's going to pause a few times throughout, and Sherelle and I will ask read those questions that are being asked. Anything we don't get to before 12:30, we will be reaching out and getting back to you with some answers to your questions. And last thing I want to say, not necessarily specific to today's presentation, is that our office, Family Support Services, is always here to help. And you can reach out to us with very specific questions and receive one-on-one consultation about whatever concerns or questions you may have for your child, yours, and the school, and the folks that you're working with. And it is our goal to help you resolve any confusions or conflicts and try to build that partnership between school and home for the success of all of our students. All right, that's enough of a plug for our office. I really am so pleased to have you here today, Dr. Hope. I'm going to stop sharing just now. There we go. And
okay, I'm going to start sharing. Let me make sure I get the right window.
And now that we're there, it did allow me to see that we do still have lots of folks that are on camera. I don't know if we have our tech support, Miss Alex, if you're still here. But anyway, making sure we're careful to have less distractions. So cameras often muted, and please keep using that Q&A feature for any input and participation that you have today. All right, Dr. Hope.
Okay, fantastic. We're going to talk about ADHD today and executive functioning. I love giving talks. It's one of the highlights of what I do, and it's very refreshing to do something a little bit different now and then. So we have an hour, just a little bit less than an hour. Ramsey's giving you all of her information, and I would highly encourage you, if you have the difficulty, if you need help, call her. I do. I call this office myself with my patients when they are needing assistance within the school system. Okay, today we're going to be talking about ADHD, executive functioning. I want to give you some tools, some strategies, some tricks, some things that will actually help with some of the challenges created by ADHD. I have a lot of slides, and if you've seen me present before, you know that I always give you way more slides than what is doable for the time period. So some of the slides we're going to breeze through. Don't panic. You're going to get a copy of all the slides if you haven't already received them. Plus, you're going to get another, I don't know, dozen handouts of things that I'll be referencing for your use. And my hope is that if you can take one thing from today, I will have done a good job. And you can get a cup of coffee and go back through the slides and learn some more on your own. So the first thing is in regards to ADHD. If you want to know further about the diagnosis, you would go to psychiatry.org. This organization is the author of the DSM-5 TR, which is our diagnostic manual. So the impact of ADHD, it is real. I always clarify with everyone, they don't realize ADHD has two categories, the hyperactive and inattentive, but there's a third component, impulsivity. So keep in mind, impulsivity. I don't stop to think before I speak or before I act. Okay. The formal diagnostic titles, they've changed over the years. We've had multiple versions of the DSM. And on this slide, you can see the actual formal verbiage that is used and the what we call the F codes for diagnosing. Okay, neurologically, I would like everyone to be able to pull from this slide what is highlighted in red. There is a 3-year delay in social emotional development. So in general, if I have someone that's 10, socially, emotionally, they're going to have some deficits that go down to around age 7. This, of course, is an average. It's a little bit of a generalization, but this is what they've found in the research. If I'm 15, I'm really going to be down at around 12 years of age and so on. So keep that in mind when, you're interacting with your children. The frontal lobe is where we see a lot of the impact for executive function ADHD. And I'm not going to go through the whole diagram of the brain, but we see a delay in the thickening of the frontal lobe, which means a delay in growth. And if we look at, there's a multitude of MRI research out there. And if we look at MRI research, what we see is that for individuals with ADHD, when they're not taking their medication, if they've been prescribed, that their brain patterns on an MRI just is not as vibrant, and all the areas of the brain don't fully light up as much as you would expect. So here again is another, example of some of the MRI research with executive function, and I know there's been a lot of talks on executive function, but just to call your attention, this slide shows many of the symptoms and difficulties that focused with executive function. So we have memory, planning, organization, time management, being able to think about our thoughts. Again, that inhibition, that, stopping ourselves, stop, think, don't be impulsive, managing our emotions, our attention. Initiation and persistence on task are two of the things I routinely hear complaints about, that my child wants to get started. They tell me they want to do the work. We have a plan, but they just can't seem to initiate, and they can't stay, persistent to the task, even when they say they're motivated. I kind of lose momentum. All right, so with executive function versus ADHD, you should recognize that ADHD is an official diagnosis, executive function or executive dysfunction is not. And most individuals with ADHD generally show difficulties with executive function, but the reverse is not true. You could have difficulties with executive function and not have a formal diagnosis of ADHD. Again, here's a website, understood.org. I love this organization. It's a wonderful resource. So take a look sometime, check it out. So, in terms of building executive function skills, I hate to tell you, but there's not a cure. There's not. We have growth and maturation over time, and some individuals kind of grow out of, I guess, if you would like to say, they develop enough skills, they have enough neurological brain growth and development to outgrow challenges with ADHD or executive function. But what that leaves us with right now is that 75% of the time we're using the environment for environmental management of challenges. And we're teaching our kiddos skills and strategies, and we're offering them support over time. The brain itself does not stop growing until 25 to 30 years of age. So when we ask how long does it take, it just takes as long as it takes. We won't know until we have a young adult, like who this individual is going to be with. So until then, we offer lots of support. We don't quit. We don't give up. We repeat, repeat, repeat. They have this saying that the only consistency in ADHD is inconsistency, because an individual will one day appear to have something and, like it's clicking, they're doing it. And then all of a sudden, there's not a connection again. And it looks as if they've lost the skill and they just can't access, the strategy or the tip, in the moment. And it's not that they're lazy. It's not that they're not trying. There's just inconsistency, in the presentation for ADHD. Okay, so your job as the parent or teacher is to actually be the frontal lobe for your child, right? Help use your frontal lobe and teach, them what you want them to be thinking and responding in each situation. So as a parent, before you can really parent your child, you have to do a little self-assessment, and we want you to be able to stop and figure out, like, what type of parent are you? So an effective parent is going to be authoritative and democratic. Although I will say, by democratic, I don't mean everyone gets a vote. Of course, parents have the last say. So we're not all going to vote and, then make the decision. But we want to be fair and involve our kids and help them to grow. So we want to build on their strengths, and we want to help, like take their areas of weakness and teach and help those areas to grow and to just become more accomplished in those areas. So do a self-assessment at another time, go through, take this slide and look at it and think, do I do these things with my children? Is this the type of a parent I am? Do I try to take the time? And granted, you can't always take the time to go with every single bullet point on this slide. But when you can, as a general sense, this is what we're aiming for, as parents. Okay. I'm going to go backwards really fast. I did give you all an additional handout on parenting teenagers, tweens and teens. And it's only, I don't know, 5 or 10 slides long, but it helps with fine-tuning some of the differences between parenting a younger child and parenting an older child. And when I'm speaking about age in this talk, if I talk about children or child or kid or kiddo, I work with individuals that are very young children all the way up through age 26. So I'm really covering a wide age range here. I'll point out nuances that might help for a younger child or might help for an older child. We're really wanting to kind of take what I'm giving you, some of these skills and strategies, and adjust them according to your child's development so that your child can access them. Okay, so where we're going to start is where I start pretty much with all my families. And this is one simple slide. Please don't minimize it. These things are imperative to having a good, healthy, functional, sound, life and good, healthy mental health. I put sleep on there first because decades ago, I used to work in a sleep lab and I learned very, very long time ago, sleep is imperative. If you do not have a consistent schedule, it messes up your circadian rhythms. That's your rhythm in life. For your daytime, I'm awake, and my nighttime, I'm asleep. It is how we process everything we've learned, how we get rid of the excess stuff that we don't need to put in memory. It helps us to stay mentally healthy. Without sleep, what I saw 20 years ago, over 20 years ago, working in a sleep lab and doing research, is people had an increase in anxiety, depression, with a lot of missing sleep. They would become a little bit paranoid, questioning their ability to learn and their memory. Everything just went out the window. So, in this day and age where kids can kind of sneak staying awake late at night because they've got electronic devices or something else to, occupy themselves, please jump on the sleep issue, truly. Eating healthy, none of it, I don't know. I don't eat healthy. I don't eat perfectly healthy. I try to. That's what we're aiming for. We don't want a high carb, high sugar kind of a diet. No energy drinks, high caffeine. We want stability. We want stable blood sugar. We don't want up and down emotional roller coaster because our diet is lacking. Exercise, movement is good for everybody, truly is. Relaxation, and by relaxation, I mean a preferred activity. So it's individualized. It's something that the person finds relaxing, not electronic. We don't want someone's main resource, main go-to for relaxing to be electronic. And we'll get into that in just a little bit. So reading, music, outside play, hobbies, arts and crafts, whatever it might be, if I were working with you, I would spend the first couple of sessions probably talking at least a little bit about this and probably trying to track some of these kinds of things, especially when I'm working with my older teens and my young adults. One of the things I do to help them to be more responsible is we track their sleep together and we track electronic use and their schedule and and I help teach them, about these things. Okay, moving on. Rules. Please, please, in your home, have rules. So many kiddos tell me when I say, "Hey, what are the rules in your house?" Some kids tell me, "Oh, we don't have rules," and what they mean is they don't have formal rules that have been talked about, listed, posted, And I would highly encourage you to do this. For ADHD, one of the things we're wanting to do is to have structure. We need to remember that 75% environmental control. That's structure. So if we have rules within a home, if I have the rules posted, listed, they're talked about within a family meeting and so forth, then I can be, like consistent in talking about the rules, and as a parent, consistent in following through and offering, correction or opportunities for learning if a rule is broken. And rules can be super simple. You don't want a big long list. We don't. I said this to a family once, and they came back with like 75 rules the next session. We don't want that. We want like 4 or 5 basic, simple, nice words, clean up after yourself, follow adult direction, treat people politely or courteous. I stopped using the word respectful a while back because my middle school kids were very quick to point out to me that such and such was not respectful, so why should I be respectful? Instead, I use the word courteous. That if I have a value of being courteous, that means being polite, then I espouse that. I try to show that to everyone, even if I don't think the person I'm with or is speaking to me is being respectful towards me. I can still show my value of being courteous. So post a small subset of rules that then you can use and reinforce within the home. You can see, oh, I'm going to back up. That's my rules. Okay, going forward again. Here we go. Routines. In the top right-hand corner, you can see I have a little mention, see handouts. So some of the dozens of handouts that you're going to be getting will be some sheets on basic routines and what it looks like. What kinds of things might be listed for routines. Routines are super important because, again, they provide structure. And I break routines up into times of day. I think about the anchors of my day, my morning and my night. I think about meals, breakfast, lunch, and dinner. I think about basic things like, okay, there's a big chunk of the day missing when I'm at school, after school activities or homework activities, and then basic other kinds of routines like bedtime or showering, things like that. So if you break your day down into your routines and you teach a routine at a time, like let's really focus on morning routine or let's really focus on bedtime routine, that that's a little bit less cumbersome. It's not as difficult as doing the whole day. So if we teach a routine at a time and we teach it, reteach it, teach it, reteach it, we're going to be more successful. At the bottom of the slide, I have the phrase shaping and modeling. Shaping and modeling refers to me um, modeling, showing my kids what I want them to do, and then actually letting them do it and take over a little bit more each day. So until they have the routine. So I'm going to back up again. I'm going to do it with them and pull back a little bit after I see that they're getting it. And then I'll know that I've taught them and taught them well. Okay, daily, weekly schedules. The schedule is a little bit different than routines. A schedule, think of like if you see a doctor's appointment book, and every 30 minutes there's a space for what are we going to be doing during this 30 minutes of time. That's what I'm talking about. And if you think my example is a little bit too detailed for younger kids, of course it is. A daily schedule is going to be, big chunks of time. I'm going to, wake up, I'm going to eat, I'm going to go to school. But for older teenagers, middle school, high school, and my young adults, I truly start working with them on an every 30-minute schedule because I want them to realize and recognize how are you using your time and, are we being really efficient? And it doesn't mean that I'm wanting people to stay busy all the time. In fact, if I'm working with you and I see that you have something scheduled 7 days a week, I'm gonna probably encourage you to have more downtime. Like let's have some couch time. Let's have some relaxation time. We don't want to, always be go, 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 go. So a daily, weekly schedule chunks the day. You're going to do this even for holidays and for snow days. If you have a schedule, children know what to expect, especially if I have a kiddo that, is comorbid and that we have both ADHD and anxiety both, then this is going to help them to not be anxious. And we know how ADHD kids sometimes have difficulties with transition and they get upset. I want to know what's going to happen because I have an expectation. And if it shifts or changes, I'm not ready for it. So have a daily or weekly schedule. If there's all of a sudden like a snow day, just take a post-it note and, write out a very loose schedule of this is what we're going to do. So that way they know when can they go out and play in the snow or when can they have a friend over, instead of asking all the time. Okay, chores. Chores is like the no-no word. All my kids hate when I say the word chores. I do have handouts again on, creating a chore list and so forth. As kids get older, I talk about independent living skills because once I am in high school and moving out of high school, at some point, I want to be able to have my own apartment, or if I'm going to college, live in a dorm room and know how to take out my trash, right? Make sure I get to the dining hall during their opening and closing hours. And if I bring food back, that I'm neat and tidy about it, right? So chores is preparing our kids, to be young adults. They go really well if we break them down into chunks, if we give very simplified instruction, very, very, very simplified instructions, right? And again, we're going to be shaping. So I'm going to do chores with my kids, especially new chores, and then each time I'm going to do less and they're going to do more. So this is an example card. If I ask someone, put away your laundry, I have delineated, I put down, um, and I would number this 1, 2, 3, 4. I have broken down every step. I have tried to make each step just one instruction. That way they can have the card in front of them, almost like a checklist. If I have to put up my laundry, mom hands me the card, and I'm going to look at my card and I'm going to start going through this is the chore. And then I'll know that I did it. I did the whole thing and I did it correctly. So take a little bit of extra time to organize, the chores and the chore list by having chore cards. And then that would be extremely helpful. Charts and rewards. Oh, charts and rewards work. A lot of families, when they come to me, they they talk about we've seen other therapists. I know about charts. I know about rewards. I'm tired of charts and rewards. They don't work. Charts and rewards do work. They do. Rewards work much more efficiently, effectively than punishments for individuals with ADHD. Charts do lose saliency. They do lose effectiveness if we don't follow them, if we don't change them up, if we don't have, rewards that are motivating, for the individual. And if I take a break from utilizing the chart or giving out the rewards, then again, it's going to lose effectiveness. So I've given you handouts with sample charts and of how I would set up a chart. A chart, again, is simplistic. It tackles just a couple of things, one or two things that I'm working on at a time. I might be tackling using my body nicely. So I might have nice hands, nice feet. I'm not going to stomp around the house. Nice mouth. I'm going to have nice words, right? Nice eyes. I'm looking at my parent. Nice ears. I have good listening skills. That might be my chart. Am I doing all of those things throughout the day? And if the whole day is too big, break it down into one of the routines. So morning routine, am I using my body nicely? Do I have nice hands and nice feet and nice mouth? Am I using good listening? And I'm wording everything in a positive way. So charts do work, rewards do work. And I've given you some examples in the handouts. I've also given you some examples on how to give a good instruction. So many times we call our kid's name. My son's David. So if I would say, David, and just start talking, I don't even know if he's listening yet. So if we just pause, we make sure they've heard us, we're engaged in a conversation before I'm giving the full instruction and so forth. On this slide, I've given you some, general ways of giving a good instruction, but I've given you in your handouts another 3 additional handouts on giving a good instruction, how to phrase things. Generally speaking, I am a proponent of, 3 strikes and you're out. If I know I had your attention, you're listening, I gave a good instruction, I give you a reminder. By the third time, I'm having to repeat myself, I have to make a choice. I'm either moving towards a consequence of you don't get the reward, or a consequence of you just lost playtime for the next hour, possibly, for an example. Or I'm remember shaping, I'm jumping in and I'm helping. I have to stop and think, is my child tired? Is my child extra hungry? Did we just have a exhausting day, like we went to Hershey Park or something, or we went to a big family all afternoon, event? So my kid's not going to be, like on it. They're going to be like a little bit hyped up possibly, or a little bit exhausted, and that's going to impact their focus. So giving a good instruction is important. Praise, praise. We have to have praise. Praise is actually super easy to do. You have a handout on how to give good praises, how to, be thankful towards your child. The easiest thing that I have found to do is to just describe what they're doing. That's it. Like, oh, wow, great. You got your shoes. Thank you. Like, oh, you already ate. Thank you. That's great. You've eaten. So I'm just describing, that's it. And I just add a thank you. We want praise statements to be 4 praises to 1 criticism or correction. And if my child has some challenges with self-esteem or depression, I really want 9. They say 9 praise statements to counteract that 1 critical statement. So, we need to be able to, add more praise statements in there. But again, you have a handout. Okay. Oh, my photo. I need to work on this slide. ADHD is talkative. We need to learn how to listen. A lot of times, my ADHD kids get frustrated because they want to talk, 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 talk. They have a thought pops into their head. They want to talk. They're impulsive. They want someone to listen to them. They're very, very chatty. If we're rushing around, I can't listen. I will want to let my kids know in the moment, if I can't listen, that it's not them, that hey, we're rushing around, I can't listen right now. Like I'll remind you of this topic. We don't want them to feel as if no one takes them seriously, or no one stops to, like listen to the things. But we also want them to be able to balance their conversational skills and to share the conversation. So, really, we want our conversation to teach 3 to 5 sentences. So, if you can share your conversation and talk with me and do this 3 to 5 sentences, and then it's my turn, right? So we want to be able to interact with them and teach them that conversational skill. Part of it will be me listening, but part of it's going to be, them learning how to share. Okay. Any questions so far? Ramsey, anything?
Yeah, we
Pardon.
don't see anything in the chat, so.
Yeah, well, one thing that popped up in the chat was the question about recording, and yes, we will share the recording as well as any handouts. And there were 2 questions in the chat. One is, I will connect you with her at the end, just looking for specific places to get an ADHD evaluation.
Hmm.
The second
Yeah.
question, my child is very spirited. She shows lots of intensity and persistence and high energy. How can I understand whether those traits are simply part of her temperament and whether they might be ADHD?
Okay, so great questions. In regards to assessment, I generally refer people to their pediatrician to see who their pediatrician works with, or to their insurance company to find out who's in network. There's a lot of private practitioners that are around, and then all of your major hospitals, including our own Kennedy Krieger, We have clinics and other hospitals do too that do ADHD assessments. It's pretty straightforward. Your pediatrician can do a screen. They can easily do a checklist screen, and sometimes they do enough to decide on a diagnosis themselves. And of course, they're guided by the American Academy of Pediatrics. So I would talk about your concern first and foremost with the pediatrician, and they can kind of tease apart, is this spiritedness or is this potentially ADHD, and kind of what's the difference? So that would be my starting place. Okay.
Great.
All right. So I'm going to go into communication skills because everything we're doing, giving a direction, wanting to guide them, talk about rules, talk about, schedules and so forth, we have to have conversations oftentimes. We're not just like giving a demand, we're communicating with our kids. And if we get into homework, you have to be able to have calm conversation. You really do. And as your kids get older, you spend less time with them. So our middle school kids or high school kids, they're going to be with their friends, maybe going to football games or clubs, we hope, right? They're going to be out there without us, and we want to be able to communicate with them so we can learn what's really going on in their lives, and they'll come to us if they have problems or concerns, right? So these are slides about communicating. One half of communicating is having good listening skills. And the second half is being able to speak and speak concisely. And you can see on the bottom of the slide, it says, use this page as a guide while practicing communication skills. We truly do this. We take this and we say, we're going to listen, we're going to listen this week. This is what we're going to do. We're going to pick some topics that you guys can have conversations about, and you're going to be reading the slide, reading these points, and you're going to practice doing this. And you pick non-confrontational kinds of topics, to have. Parents need to have these communication skills really, really solid in order to teach your kids. If we amplify, they're going to amplify, right? If we calm down and chill out, then chances are they might amplify, but they're only going to amplify just a little bit above us. They won't go quite as high, right? So learning how to communicate is essential. Take 10 to 20 minutes several times a week. Practice doing this. Do this very specific, directly, like tell them, this is what we're going to do. We're going to talk about something, but we're going to be working on communication skills, right? With communication skills, here's a list of don'ts. We don't especially want to insult, use criticism, defensiveness, or stonewalling. If you all have ever heard of the apocalypse, the four horsemen of the apocalypse, there's some researchers out there, the Gottmans. They have done quite a bit of research on communication with couples and with parents to children as well. And those are the four most hurtful forms of communicating. They really tear a relationship apart. So we don't want to do these things as parents. And in terms of what we do want to do, and I put the first one first on purpose, state your intention. If kids understand your intention, a lot of times, then they recognize like you're not just being critical, that you care, that you're trying to teach. My best example, when my son, he's older now, but when he entered ninth grade, he came home one day and the kids were going to a concert on a Sunday in the country, and he was so hyped. He wanted to go. And I was like, it's a school night. So I had to stop and back up and say, I don't want you to miss school. I don't want you to be tired. I don't want it to mess up something. You just started ninth grade, everything. So my intention isn't to break you and your friends up or have you miss. He hadn't been to a concert yet at all. But he wanted to go. So I talked about my intention. So he knew I cared. I wasn't just trying to stomp on his fun. So again, practice communicating and practice, do some self-assessment. Am I communicating well? And then be able to give, positive feedback nice feedback to your children, when you're practicing these skills. Body language and facial expression, excuse me, is also something you really want to focus on. When my kids were younger, I oftentimes, because I'd come home a little bit tired and everything, so I know I was coming across without a lot of affect, not a lot of expression. I wasn't smiling maybe as big as I normally do on the weekends and stuff, but I had to stop and especially with my daughter, I would go, look at me. Do I look angry right now? I'm not trying to be angry. Mommy's just tired, right? So we have to teach people to slow down or to be attentive and focused on body language and facial expressions in order to have good communication. What emotion am I feeling and showing on my face and in my body? How do I read body language? And how do I watch the volume and tone of my voice? I don't have it on this slide, but I did give you a handout on this. I know I did. You can print this out if you wanted to, and you could watch a movie like the Inside Out movie, or you could just watch a regular television show that's one of your kids' favorite television shows, and you can, watch it with the volume down or the sound up, either way, and point out when you see these things. And you can practice by watching other people. And then you can practice, at home also. Okay. Tweens and teens, I already told you, I have given you an additional handout, some nuances of working with kids that are a little bit older for parenting. I did the same thing with social interactions. If our kids have friends and are doing things with friends and they have activities, they're definitely happier and they feel more included and we want those things for our kiddos, but these could be two fully separate talks. Technology. Technology is a pet peeve, and I will try not to get on a big soapbox about this. I guess it's a pet peeve because it's a goal I'm working on myself. I've recently been reading a lot additional research on technology and the impact to humans and our brains and our development and growth and our aging especially. Um, so with ADHD kiddos, we've known for a long time that, you know, it interferes in making friends. We only have friends online. We don't get to practice face-to-face social interactions and social skills, body language, tone, all of those good things. I'm not interacting with my family as much, so I'm not teaching family values. We've known for a long time video games increase aggression, decrease empathy, and lower academic performance. Like think about that. I was reading about and learning that before my son was born, and he's 22 now. So we've known this. Social media, we know, increases anxiety and depression. It really creates a big risk for emotional mental health difficulties and challenges. And my ADHD kiddos, think about it, they're not always stopping to think critically. They're sometimes impulsive. They don't have environmental cues, they just have a screen. And so if they're socially interacting, they're more at risk of making a mistake. So, stay on top of this, their electronic use. What we've learned more recently in the last 10 years is that there's actual chemical changes in the brain that occur when we have electronic use, right? And we're not, how many times do our kids tell us, "Oh, that's boring. I'm bored," and they want to get on their phone or their tablet or a video game because it's like dopamine, right? It's all the lights, camera, action, it's Hollywood, it's, all of those things that capture the brain and give us stimulation immediately. So I've put a lot of slides in here, half a dozen. You can read through this. It impacts language, reading skills, social skills, memory, understanding facial expressions, body language. It impacts our attention. It impacts cognitive control. And even for toddlers and preschoolers, it impacts early reading skills and cognitive skills. So we want to limit electronics. I threw this slide in just for us, the adults, right? It impacts us too. Even though our brain is fully grown, now it's aging. And what we've found is that electronic use ages the brain more quickly. Okay, so the suggested use, and if you go to American Academy of Pediatrics or NIMH or whatnot, you're looking at age 5 and younger is 1 hour per day, and they really want a parent participating on educational programming only, not video games. Age 6 and older, including adults, right? Us, no more than 10 hours per week, right? And this includes like looking at videos, reels, social media, games, video games, all, movies, especially when the screen is right here, right? All my peripheral vision is cut out. I've got it right here, and that seems to be a bigger challenge, bigger problem. And the other age limit that they're suggesting is to not really give ownership of a phone or a laptop to an individual until they're at least 16, and then set limits, right? Stomp on, keep track of hours so that we don't really exceed the hours usage time. Okay, so here's a slide list of other extracurricular, other activities, other kinds of things that you might be able to do. We want to talk about free time. We want to be able to encourage our kids to get up and go out and do things or do other activities around the house. I gave you all a handout on, I think I titled it something like things to do when you're bored. And it's like 80 items of odd things that you could do. And when you're bored or when instead of using electronics, one of the things is just walk around your house and stop and look for all of the leftover hobbies and arts and crafts and games that you've forgotten about and make a list and start with the things that are already in your home. Okay, brain health, super important. Here are some positive things you could do, some other ways of spending your time. Okay, I'm pausing again. Ramsey, any questions?
Yeah, so much that is being shared today. I will share one of the questions, which is probably felt by many, that this is great information, but does leave some parents feeling slightly overwhelmed on where to begin. I
Yes.
suspect the answer is obviously it depends on where you are and what it is you're dealing with, but it's a good question. Where do I begin with all of this information? Where should I start?
Yeah, really good question. It does depend on where you're at. If you haven't had an assessment, go to your pediatrician and get an assessment, get a general questionnaire assessment. If they feel like they can diagnose, fine. If they can reassure you that it's not ADHD, fine. They can refer you out, right, for a fuller assessment if needed. Back in the very beginning of the slides where I had a slide, where do I begin? So structuring your day, having rules, having, routines, having a schedule. Those weren't just filler slides. They really
Yeah,
weren't. They
yeah,
were imperative in being able. So I sometimes meet only with the parents and we figure out, do I have to wake up an hour early to get myself ready in order to have everything else done so I can now start shadowing my child to teach them morning routines? We need to have those things done. So those weren't filler slides. Those were important. I would assess what's going on within your family and for your kids and figure out like, okay, well, what are we doing well based on the things that I'm presenting today and where do we need help? And I would start with one of those areas that might be a little bit easy to just like give you guys a nudge to show some improvement. So you have to assess like where's the best place to start, right? Okay.
great. Thank you
Good.
so much. And I
Yes.
did notice we have both the chat and the question and answer open, and
Oh,
Sherelle and
wow.
I will continue to do our best to
Good.
answer some of those and share some of those. And again, if we don't get to all of them by 12:30, we will be reaching out after.
Yes, yes.
All right.
Okay, so for schools and school accommodations, schools are generally speaking really well versed at managing ADHD. Teachers are trained, they understand what ADHD is, they understand how to set up their classrooms and keep things organized and so forth. And we have 504 plans and we have IEPs for individuals that have ADHD or other kinds of challenges that help create a plan of how to help your student in the school setting. If you're having difficulties and challenges in the school, I would highly suggest that you reach out to the school. And if you don't have a 504, that you ask for a 504 meeting, you ask to meet with the teacher, and you figure out what kind of resources and supports things they can put in place. They're going to be focused on structure, rules, routines, schedules, all of these same kinds of things I've been talking about. I've given you all an extra PowerPoint, small PowerPoint, I think maybe 10 slides on school accommodations and things that we can do for improving homework and interacting with the school. I've also given you a handout on common educational accommodations that we utilize too. So school is a very big topic. This slide, if you feel like your child has difficulty being on task, this is an instruction page on task self-monitoring. So this is exactly how to do it, what to do, how to do it, how to help your student realize I need to improve on my, on task behavior when I'm sitting doing homework. It takes me 30 minutes. I only needed 5 minutes. So if you practice self-monitoring at the same time, as doing homework, your homework then improves. Mindfulness, I have a packet that I've given you, and mindfulness is discussed in the packet as well. Mindfulness means my brain is thinking about what I'm doing in the moment. I'm talking to you guys right now. I'm operating my computer. I'm not thinking about like, what is dinner going to be tonight, right? I'm not trying to file my nails and multitask. So mindfulness is attentiveness. And if we can teach how to be mindful, then it improves difficulties of ADHD. And again, there's a packet of information that talks about how to learn mindfulness skills and how to practice mindfulness skills. You don't have to become a huge meditative individual where you meditate an hour a day. You can do it in small little snippets and you can just realize like, am I on task right now or am I not? Homework routine is extremely important. We want homework routine to be that word, routine, right? Location, time. I want to do the same thing in the same way every single day. You want to interact with your kiddo and keep them, like participating in talking about how can we improve our routine. We want the TV off, we want electronics out of the way. I want, like someone that's going to be able to help my kids in the moment. So if I'm not the best person, like who do I find? Is it a neighbor person? Is it an older sibling? If I'm not best, maybe I need them to be online, with a phone call to their aunt or someone that is going to be able to kind of talk them through some things. In these two slides, I've given you some really good tidbits on how to set up the homework routine. The older the kids get, the greater they need to participate in creating their homework routine. Here are three: goal setting, beat the clock, and response costs. These are three little strategies that help to keep the homework running, in a timely, engaged kind of way. They're very self-explanatory if you go back through and read them so that homework is not so aversive. Okay, so let's see. That just says there's another PowerPoint. Okay, emotion regulation. I have a few slides on this, and I'm gonna kind of zoom through them.
Yeah,
And
I was just going to give that time check. We're at
yeah,
12:25.
oh yeah,
So much to cover. Yes.
right. So emotion regulation is important because frontal lobe, I need to have impulse control. I need to not let my mood and emotions kind of, like sway everything. So there's a handout on emotion regulation. It's actually several pages long. And we talk about how do I identify my actions, feelings, and thoughts. And there's a thought log monitoring system. So if I can teach myself awareness, I can, kind of monitor myself and learn how to slow down a little bit. Um, this is just an example of a way to communicate how I'm feeling in the moment. Am I going to use colors, red, orange, yellow, blue, green? Am I going to use numbers 1 to 5? Am I going to draw faces? I need to be able to communicate easily. And, this book is just a really good way to demonstrate that. I want to have tools to tolerate stress. Radical acceptance is like we do it all the time. If we're driving to work and we get stuck in a traffic jam, radical acceptance. Oh, well, I'm stuck in a traffic jam. Nothing I can do. I just have to sit here. It doesn't have to ruin my day, right? The size of my emotion needs to be the same as the problem or smaller. That works wonders. It's from this book here. And the message is to create a list of solutions for reoccurring problems. If I measure a problem at medium, I should have a list of, oh, here are my medium reactions I might give, and it needs to be medium or less. So I can practice that and talk about it with my kids. In your handouts, there's an instruction sheet on balanced or paced breathing and how to reduce, your stress using body temperature as well. It works wonderfully well. Mindfulness is in there. There's a page on utilizing apps to help you learn, relaxation. And even 1 or 2 minutes a day, just that's it, 1 or 2 minutes listening to something it teaches. And after, if we do it every single day, we pretty soon know how to just like breathe a little bit and settle ourselves so we can then be focused and calm and persist on a task. Okay, please go back and read through this. We have so many kids, as they get older, they tell me, my parents just don't listen, and kids need to vent. This talks about what you as a parent do. It's called validation. I didn't put the word validation on here though, because it's such a big, confusing word. You really just want to listen and emote back their experience, just so that they know you heard. That's it. So let them vent once in a while. And later, if you need to help them like learn from something they tell you about later, a day or two, a week later, you can go back and you can teach them problem solving. Okay. Um, Empathy and tolerance is also something you want to concretely, speak about. Okay, the next few slides, please go back to and refer to at your own time. They really talk about therapy. Therapy works, who it works for. It mentions medication. You would talk to your pediatrician. Medication does work, right? If your kids are feeling at a loss or you're feeling at a loss, please talk to the school or get outside help from the pediatrician or one of these agencies, within Baltimore. We're a really large place. Here's my contact information. I welcome people reaching out. You have my email. I'm in the midst of moving my office down the hall, so I gave you our care center's telephone number, but they will send me an email if you call them, and I will call you back. I'm happy to do that. And then I've given you a lot of resources of where I pulled much of this information from. All right, Ramsey, where do we stand on
Thank you
questions?
so much. Well,
Yeah.
we've reached our 12:30 mark, and I do want to honor everyone's time and lunch break. I know some folks are munching at their desks at work, so I will work to get some of these questions addressed outside of today. I just want to take an extra, you know what, I'll share this last screen I'll share just with some contact from our office as well again. But what I mostly, hold on, let me get that screen up. There we go, and share. That was some questions that popped up were about whether they could reach out, how they can reach out. So I'm going to share that again. Thank you for all of your contact information. Excuse
Yes.
me, get into presentation mode, get this up here for folks before everyone logs off. There we are.
We did.
So again, just thank you so much, Dr. Hope. You are, like I said, I know you could continue to talk on this topic and go in depth. We are very excited. I said this in the chat for those who may have seen it in the chat. We are going to have you again in January. We also did record today, and we will be able to share the recording and those handouts that you mentioned. They were not emailed ahead of time. The PowerPoint was, but I will follow up with those handouts and the recording. And then to those of you who were asking about reaching out to our office or to me or to Ms. Pinkett, or our supervisor, Kenya Golden, who is, I know, a participant here with us today as well. There is our phone number and the QR code to reach us. But what a pleasure. Thank you so very much, Dr. Hope, for
Certainly.
your time and your expertise. And for all of those families, I wanted to say, yes, just logging on today was an important first step for those of you who are, where do I begin?
Yes.
Doing this today on your lunch break was a great way to begin. And your school certainly will be there as your direct line of support as well, and our office, and then Dr. Hope. Thank you for also being a community resource as we all work together in partnership
Yes, we
to
do.
support our children. All right. Well, I hope everyone has a good Wednesday afternoon and rest of your week. And thank you again for logging on.
Thank you, everyone. Thank you.
Sweet. Lots of lovely reactions as people are logging off. Yeah. Definitely, I look forward to going through some of the questions we didn't get to.
Yes.
It was a little hard, but I think Sherelle and I did the best we could. We had questions popping in Q&A, which is where I thought the chat was going to be disabled so we could just keep it in that one place. But we were looking at both, and there's some good questions there and great conversation as
well. Okay. So they're going to save the Q&A. What about the chat? Were there a lot in the chat that
yeah, and the thing about chat is it's hard to, the nice part about the question and answers, you can click that they've been answered and then have all the open ones still open.
okay.
Lots of comments. Our supervisor, Ms. Golden, shared again the slides, but I will follow up with emails to everyone.
Yeah, I was just trying to read through the chat. Are we going to lose the chat?
No. Well, I know Alex in your department is going to have that, but I certainly.
Is she going to have the chat and the Q&A or just the Q&A?
On from logging off just in case, but I do, I think that we get both. I know we get the question and answers. I think we also get a transcript of the of the chat, but we'll and scroll through that just in case we lose it.
Yeah, that's what I was going to say. Do we need to stop and take notes to make sure that we have, like we know all the questions? Um, okay. Oh, wow. So there was one on hyperactivity, it looks like.
I saw more than one about the tech when you were talking about technology,
Yeah,
you know, just more comments than questions, but some of them were
yeah.
questions. Of course, often students are on laptops for school to do work,
Yes.
and is that screen time, or do we want to use screen time
Hmm.
to record? Family movie night and things like that are sometimes used, and so just sort of balancing what is the
Right,
that is damaging and what is the screen time that is necessary or a reinforcement. That was a good question, and
right.
yeah.
Okay. I'm looking a lot of, yeah, I'm seeing what you're seeing. Yeah, I still use screens as rewards as
Yeah,
just, but
and other participants and parents were providing their own answers, which is what one of the moms said is no, a family
mhm,
movie night does not count against as
right.
managing screen time.
I feel like if the screen is not in front of their face like this, if it's at a distance, I have peripheral vision, all that kind of stuff. Um, we don't want to do a lot of that either, but that's definitely more of an interactive, with the family kind of a thing. It's not individualized.
And then there was one question. I think that when you got to the slides on emotional regulation, it helped
Mhm.
answer some of what came in the chat. There was one around control her son having difficulty controlling his body sometimes, kicking legs, squirming, upper body,
Yeah,
can't sit still, um,
the hyperactivity aspect,
activity
right?
active ADHD. So I'm not sure, but there were certainly lots of resources. I know you mentioned very quickly at the end some of the therapies and some of the medication
Mhm.
options that are um,
Right. I don't want to ever, I'm not good at pitching, like come see my clinic. You know, I don't want to come across as, that. I feel like there's so many great resources in Baltimore and people need to go where it's easy and where it's within their insurance. So if they end up at Kennedy Krieger, great, but I don't know that it's necessarily has to be a starting place. Really, the pediatrician should be helping to guide things.
Yeah, on that topic of where to go, probably worth me saying out loud, which I can't go back and do. I know we have just a few hanger-oners, but I wrote in there also when the ADHD clearly has an educational impact, there are, um,
Yes,
there's the whole child find process and the evaluation process, which is at no cost to the family.
correct, right.
That is an IEP process. The team would,
Mhm.
often we have students who with ADHD who do not qualify for an IEP. So we still, in those cases, those families are still working with the schools around student support plans and strategies. Maybe
Right.
504 plan
Hmm.
becomes very clearly significant in their impact. Then there is the chance that the team would be ordering assessments.
Right.
So I did
Right. Yes.
answer that folks may have seen if they were following the chat. But that was
Okay. Okay. Well, we'll get the Q&A for sure. Maybe the chat too, but the Q&A for sure from Alex. Did you by chance see the number of people? Because I wasn't focused on.
I saw it in the high 90s.
Okay. I was
Rally here, do you know? I think high 90s is the answer for
okay.
majority. It kind of went up and then a few people logged off. Yeah.
Well, right. People come in for their lunch.
Yeah.
So
That also
they're busy.
will be transcribed. So you'll have a
Okay.
copy of the number of participants, um, definitely the Q&A, also the chat, but I'm glad we went through that just in case.
Okay. All right. Good. Good, good.
Yeah.
Okay. It sounds great.
Uh,
Sounds like things went smooth. We got a recording.
yeah. Oh,
Okay.
actually, you know what? Because I can stop recording.
Okay. Okay.